thank you for clicking on this video. My name is Lily. I am a new grad registered nurse. Apologies because I've been really slow with putting out videos. Right now I am waiting for my endorsement to be processed through California. I am also applying to a lot of jobs. That has kind of been like a waiting game for me because a lot of the positions I apply to are new grad and they kind of just take a while, I guess. Today's video, I wanted to talk about NCLEX. I took my NCLEX a little over 2 months ago. I passed with 78 questions, which I believe is 3 over the minimum. I wanted to talk more about how to actually study for NCLEX, keeping in mind how I personally study for NCLEX and how, looking back, how I wished I had studied for NCLEX. Of all the videos that I have planned to make, I figured this would be the best time to make an NCLEX studying video because I believe that most students following a traditional college university calendar, they should have either just graduated or will be graduating within the next month or so. So I figured it's a good time to start trying to figure out how you're going to study for NCLEX. I'm going to do my best to keep this video as brief as I can. I'm just putting out a disclaimer that everyone has different studying styles, so you are free to use my recommendations or not use them at all. And of course, I always suggest that you tailor it to your own schedule and your own preferences. How I recommend and how I wish I studied for NCLEX is I really wish that I had first set up a study schedule and kind of just figure out my timeline, at least a general timeline for when I would start studying, what I would start studying, and how I would start studying, what resources I would use, things like that. Personally, I recommend taking the NCLEX as soon as you can. It might differ though because it might take a while to actually get your authorization to test. You have a longer time in between nursing school and the NCLEX, which means you're gonna have to start reviewing a lot more and probably a lot more in-depth. I took my NCLEX exactly a month after my ATI test, and my ATI test was the day before graduation. The reason why I recommend taking your NCLEX sooner rather than later is because the information is a bit more fresh. Your way of thinking when it comes to test taking is still in that nursing mindset that you have to have. The first thing I would do is to create a study schedule, and your study schedule is going to be based off on when you plan to take the NCLEX. Schedule your NCLEX date and then figure out how you want to study from then. Since I had just taken my ATI test, just finished nursing school, I wanted a little break, so I gave myself a week break, and that left me with about 3 weeks to study for my NCLEX, which honestly at the time it felt like it was enough time for me just because I had been studying for my ATI test, and the ATI test is a comprehensive test predictor for the NCLEX. I felt that I already had a good grasp on all of the concepts and all the information that they needed us to know. But yeah, that left me with about 3 weeks to study. I recommend having at least 4 weeks to study. I think 4 weeks is a really good timeline. The first week, I would really just go over the topics that you don't need to go super in depth on. Things like labs that you need to know, med math, and pharmacology. At the very least, those things. Understand what kind of math you want to use for doing med math. Doing a few practice questions with each different kind, so like things with drip factors, things that have weight conversions, stuff like that. Just basic med math. Get that out of the way with studying. I would start pharmacology because there are a lot of drugs that you need to know for the test. You'll never know which ones you're gonna need to know, and meds have so much information that is attached to it. I would really focus on learning, memorizing prefixes and suffixes when it comes to medications. Those will help you a lot so you have less information to remember. Also, labs, because labs and medications are going to be things that are going to carry you throughout the rest of the concept. Specific disease processes are going to affect specific labs. Medications are also going to affect labs. Getting familiar with labs and medications from early on will really help you with the rest of the concepts that you have to study. Also, in the first week, I would try to go through health assessment, so a good head-to-toe assessment. What are some things you look for during a head-to-toe assessment? What do the results of a head-to-toe assessment tell you about your patient's condition? How does that relate to expected lab findings, expected interventions, stuff like that. In the second week, I would really hit on fundies and med-surg. Then the third week, I would hit maternal-newborn and pediatrics, and that in itself is like a whole new realm that you have to study. It's different labs, different medications, different disease processes. And then on that fourth week of studying, I would try to hit mental health care of older adult, community, and leadership, which shouldn't take that long to get through. I think those are some of the smaller modules that we typically go through in nursing programs. It's a bit more holistic in terms. First, second, third, fourth week, I would hit those topics like that, and then the closer you get to your NCLEX date, just try to keep reviewing a bunch of other concepts. Okay, so that was the study schedule. First week, basic stuff. Second week, fundies and med-surg. Third week, maternal-newborn and pediatrics. Fourth week, mental health, care of older adult, community, leadership. How would I go about actually studying for NCLEX? If you watch my NCLEX study blog, I think you can see I didn't have a very good study routine. It was a lot of procrastination and a lot of lying in bed, and it was all completely just UWorld questions. Looking back at it now, I actually do regret doing that. It worked out because I passed. However, I do think that if I had maybe been a bit more disciplined with my studying, I would have definitely been less stressed. Because when it came time to take the test, I felt like I just didn't have enough time to study, that I didn't really know anything. And using UWorld in itself, it's a great resource, but it's a very stressful resource to use. So how to actually study for NCLEX, I would recommend having something that has a question bank. So UWorld, I think, is a really good resource to use. But don't let that be your only resource, especially if you're not able to take NCLEX as soon as I was. Definitely try to incorporate different resources. Just getting the different nuances about specific things, I think, will make you feel a lot more balanced, and it'll make you feel a lot less stressed than I was when I was studying. UWorld is great because it has all the different kinds of questions. It looks almost exactly like how NCLEX looks on the actual computer. The reason why it was really stressful was because UWorld looked for very, very specific things, especially when it came to SATAs. We already know how tricky select all that apply questions are. UWorld was just like another level of, how can I make this person feel really stupid? That's how I felt like when I was doing the UWorld quizzes. On the practice quizzes that I would be doing, my average would be somewhere between 50 to 70%. And I think you can see how that might make someone stressed. When you're taking practice questions and it's only out of 75 questions and you're getting a 50 to 70% on that, it makes you feel like you don't know what you're talking about. I did a practice test right before my NCLEX. On that practice test, I got like a 70-something%, and UWorld said that I had a really high chance of passing. So that made me feel like a lot better after seeing that. But yes, if you're doing UWorld, I would recommend getting a package that has like a practice assessment in it, because even if you're doing the practice question from the quiz bank, there's something about the practice test that feels like a little different. It makes you feel a little better once you see that you have a better chance of passing than how you're actually doing on those practice tests. Going back to incorporating other resources, there are a ton of resources you can use for NCLEX. There's the Saunders textbook, and the Saunders book is a great resource to use throughout nursing school and to study for the NCLEX. I know I didn't use it, but it's a really great resource because the book itself takes you through how to take the NCLEX, what kind of questions to expect, how to answer those questions. It takes you into like the really important like things that you need to know, and then it gives you a bunch of practice questions. And practice questions are really what's going to help you, because at this point, getting ready to take the NCLEX, we have been through nursing school, we finished nursing school, we should know all the basics when it comes to nursing knowledge. And so doing these like practice questions help you kind of to think of a disease process or specific things about a disease process or a medication. It just helps you look at it in a broader view. I felt that when I was studying for NCLEX, I was just like, well, I learned this concept in a specific way, but I never really thought about how it affected this or how it affected that, or that it could look like this, or it could be worded in a different way too. Doing a bunch of like practice questions helps you get used to how diverse wording can be and how things can be interpreted differently by different resources. It helps you go into NCLEX a little more prepared. How I recommend studying for NCLEX is really just taking your time, going through a bunch of practice questions, scheduling out your studying, sticking to that study schedule. When it comes to studying for NCLEX, it needs to be very intentional. My biggest regret with how I studied really is that I procrastinated. It's hard to say that I regret a lot because I did end up passing, but like looking back at how I studied, I really would not recommend studying like how I studied for anyone else, just because I felt really stressed and really unprepared going into NCLEX, which really sucks because that is an expensive test. And the last part are some study tips, if the other things weren't study tips that I mentioned. This last part for study tips, okay? This is something I wish I kind of had focused on a little more in nursing school. You kind of unconsciously learn this through nursing school, it's test taking strategies. And they kind of did teach us it back in the beginning of nursing school, but not like how I ended up learning it towards the end of nursing school. If your school's using ATI, there is a module that actually goes really into depth on test taking strategies, the kinds of questions that they use in NCLEX, and how to answer them, what to look for, things like that. So Nurse Logic 2.0, testing and remediation. Look through that before you study for NCLEX. Focus on both nursing knowledge and test-taking strategies. Those are both almost of equal importance. Test-taking strategies will really take you a long way. It takes out like half of the thinking. When you're studying, I would pay attention to a lot of procedural stuff. This is where I would look to different resources, kind of just to see if they keep the same order of stuff, because I did have a few questions on procedures on NCLEX, and most of the procedural questions on NCLEX are going to be like a drag and drop order thing, or the ones that I got. Some examples of procedural things would be like a wound dressing, central line dressing change, how to insert an IV, how to insert a Foley cath, how to do intermittent bladder catheterization, how to take care of a body post-mortem. Make sure that you know what's supposed to be going on and in what order. Like it could be a potential question on the test. One more thing. If the question states a specific age, there's a reason. Like, you would think that's kind of obvious, but sometimes you're reading a question and you're just not critically thinking. Let's say, for example, that you have a 2-month-old baby who is brought into the ED and the parents say that the baby rolled and fell off the bed. What's wrong with that question? It's a 2-month-old baby. 2-month-old babies cannot roll. A lot of the thinking should stem from like that. If you're reading the question critically, if they state that the patient is an older adult, then some of the disease processes might not look the same as they would in a regular adult. Well, I think that's it for this video. I just really wanted to talk about how to study for NCLEX, how I wish I studied for NCLEX, what I regret about how I studied for NCLEX, and just some extra tips and things to think about when it comes to studying for NCLEX. Yes, this was a whole NCLEX video. I hope this video helped at least a little bit. At least I hope it helps you to understand what not to do when to study for NCLEX. If you are taking your NCLEX test soon, good luck to you all. Thanks for watching, and I hope to see you in any of the other videos that I make on this channel. I am starting to make a lot of non-nursing related content just because I'm no longer in nursing school, so there's not a lot to film now. I'm gonna be trying to alternate between a nursing video and a non-nursing video, and I'm hoping that once I actually get a job and start working as a new grad nurse, that I'll be able to share that experience, because I'm honestly very nervous to start working, but I'm also really excited to start paying off my loans, because student debt in America is, you know, it's another level of insanity. Good luck on your nursing journey. Please wish me good luck on mine, and thank you for watching.